My patient was not aware that Lyme disease could mimic his mental health disorder. He had been diagnosed with multiple conditions that included anxiety, rage, OCD, and depression. He was also quite irritable, and he had tried various therapies. He had been through counseling, and yet he remained sick. There were other issues that he wasn't so aware were connected, which is brain fog, fatigue, and dizziness, which in his case fit the diagnosis of postural orthostatic tachycardia syndrome, POTS. I looked at him with regard to Lyme disease, and he didn't have the tick bite or the rash, which would have been telltale signs that would have indicated looking for Lyme. He actually had a positive Lyme disease test, an IgG test in the past that was thought to be an old infection. He wasn't aware that it could possibly be a persistent tick-borne infection that hadn't resolved. He was started on treatment, and fortunately, his mental health disorders improved. His anxiety and rage subsided. He had OCD, but not dysfunctional. His depression lifted, and his brain fog and fatigue lifted. So it just reminds us that Lyme disease can affect the mental health that patients have, but it can also affect the physical health. It can mimic anxiety, panic, mood, OCD, and bipolar disease. The problem with misdiagnosis is that there's time wasted and suffering from not having Lyme disease being considered. It could be why sometimes the medicines for mental health disorder are not working very well. In this case, it was fortunate enough that he was treated and he did well with treating Lyme disease. It's also important to know that Lyme disease can mimic other diseases. So I have patients that have been diagnosed with multiple sclerosis, rheumatoid arthritis, fibromyalgia, and chronic fatigue syndrome. Now, if it is Lyme disease, it can be a life-altering situation if Lyme disease is underlying the problem and treatment starts for Lyme disease. The final thought is that mental health symptoms can be related to Lyme disease. If treatment fails or treatment doesn't work very well for mental health, I always advise patients to revisit Lyme disease, see if that is an underlying factor. Recognizing Lyme disease impact is important for families and for patients. So thank you again for joining me for a common sense Lyme disease discussion. I'm Dr. Cameron. If you have any questions or comments, leave them below and I'll do the best I can to answer them.